My favourite bird is rainbow lorikeets and budgies and kin parrots.
When Thomas was first diagnosed with leukemia, we were in complete shock. The day we came in, we weren't at all expecting our son to be diagnosed with cancer. I think for the first 3 months we walked around in shock, not knowing what to do. When we met a lot of the other families who were treated with the same type of cancer that Thomas has, ALL, it was quite evident that a lot of the children reacted differently. The treatment may have been the same, but the outcome of the treatments for the kids was quite different, and that was quite confronting, particularly with one family that we met where it was the same diagnosis as Thomas and he didn't make it. So that's where we think the research is so important.
The most common form of childhood cancer is acute lymphoblastic leukemia. We see about 40 to 50 patients a year in our hospital, and it represents about 25 to 30% of all of patients. It's been well known in that disease that 2 patients can present in the hospital and they're treated with exactly the same treatment course of drugs, but one will survive and one won't. We want to understand what are those hidden molecular switches, pathways that may be causing that patient not to respond well to the current therapies. The research that we're doing with big data mining, visualisation, in conjunction with UTS, will eventually be the diagnostic tools of tomorrow.
My research is all about using data science to better treat kids that have cancer. My area is to help them to make sense of that data, to transform it from this very high-dimensional 80,000 pieces of information down to smaller information where they can see the relationships between the different patients so that we can predict whether a patient will relapse or not and to help the clinicians to make better decisions.
We can't hold him back at the moment. The things that he loves to do, he loves to play cricket, we go swimming, we just want to be a kid and enjoying all the things we love to do.